It's nice to meet you.
Nice to meet you too. I am Dr. Karam's nurse, and I'm going to be going over the post-operative and pre-operative instructions with you.
Okay.
Well, so basically preparing for your surgery 2 weeks before and 2 weeks after, we don't want you to take any ibuprofen or aspirin products, okay? Because these are blood thinning. And so that includes like your Advil, Motrin, Aleve, aspirin, Excedrin, Midol, that kind of stuff. But Tylenol and extra-strength Tylenol is totally fine. So if you get a headache or something, that's definitely fine to take. Okay? I know that you don't smoke, but no smoking 2 weeks before and 2 weeks after. And then no alcoholic beverages 2 weeks before or 2 weeks after, because this is also blood thinning. Okay? And anytime you intake anything that's blood thinning, it's going to slow the healing process down. It could cause you to bruise more. It could cause you to bleed more during surgery as well. So those are just all things that we want to avoid. Okay. Will you have someone with you the first 24 hours?
Yeah,
okay.
My mom.
Okay, perfect. So that's something that we require just in case you need anything, because you could still be out of it with the IV sedation medications and that type of thing, and if you're taking the pain medication. So the day before your surgery, you will start your antibiotics as directed, and I'll go over your prescriptions a little more in detail later. And you're also going to wash your face, and I have the packet right here, so you will wash your face with half of this packet here. It's an antibacterial soap. You'll use it half of it the night before and then half of it the morning of before your surgery. Okay? And with this, it can be kind of drying to the skin. So the night before, you can definitely put a moisturizer or lotion on. That's completely fine. But the morning of, we don't want anything on afterwards. Okay? All right. And then just remember, for IV sedation, there is nothing to eat or drink 8 hours prior to your procedure. Okay? Like I said, you're going to wash with the other half of that antibacterial soap, nothing on afterwards. And then if you have any usual medications, you can take those with a sip of water. That's okay. Just don't drink a whole bottle of water or anything like that. Okay? You're also going to take your 1 Ativan. That's your anti-anxiety medication. You'll take that 1 hour before arriving here, and that'll help get you more comfortable. And then we give you a second one here, so help bring the anxiety level down a little bit. So, and then of course we'll do the IV sedation with that too. As far as what we kind of recommend that you wear, we recommend that you wear something loose and comfortable, something that zips or buttons. You don't have to try and get it on over your head afterwards, because your head is going to be wrapped. And so it'll be a lot easier if you don't have to try and get something on over your head. Also, no contact lenses if you do have them, and then no jewelry or piercings or anything like that. That all needs to come off or out and stay at home. We do, however, have a locker here that you can lock your belongings up in, like your clothes and that type of thing. High protein diet is what we recommend. Protein promotes healing, so it'll help aid in the recovery process. Okay? Low carbs and low sodium. Anywhere salt goes, fluid's going to follow, and you're going to hang on to that swelling longer. Okay? So it's hard to completely avoid sodium, but I mean lower contents of that would be better. For the first week, you're going to rest with your head and shoulders elevated on 2 to 3 pillows. And then try to stay on your back as well. Okay? So with that, it's kind of like if you were to twist your ankle, you want to kind of above the heart type thing. So same thing, you want to get the swelling out and not be laying flat. Okay? So it is okay to take 2 Tylenol every 6 hours as needed for discomfort. I'm also giving you a prescription with a little bit stronger pain medication as well, and I'll go over that a little bit more in detail later. Okay? Anytime, if you do take the stronger pain medication, make sure you do have something solid in your stomach. So eat something solid. I know a lot of people think they can get away with a protein shake. You need something more solid than that. And then I usually say wait about 15-20 minutes and then take your pain medication. And you should, if you tend to get nauseous or anything like that, that should help a lot. Okay? Okay, and then with pain medications, if you do decide to take them, they can cause constipation. So we do recommend Colace. You can pick it up over the counter. It's a stool softener if you need it, okay? Let's see. And then you can shower and shampoo 3 days after surgery, because you are doing the laser as well. And we don't want any water on the skin at that point until the 3rd day.
Okay.
Okay. And then you're just going to gently pat the scalp and face dry. You know, you don't want to rub or anything with the new incisions and that type of thing. So,
Okay.
And then as far as coloring your hair, I'm not sure if that's something that you do or not, but you can't do that for 4 weeks following the facelift, just because those incisions are right there, and we don't want those chemicals reacting with the incisions that are there, irritating those. Okay. You can resume driving 2 to 3 days after, as long as you're not on the narcotic pain medication, and as long as you feel comfortable doing so.
Okay.
So this is a risk that comes with the procedure, with the facelift. The risk is a hematoma, and I don't know, did Dr. Karam talk about that at all?
He did mention, he said something they had to do with some of the blood thinners as well, why you want to stay off of those.
Right, did he tell you what to look out for that too?
He mentioned something about rapid swelling and pain.
Yeah,
Okay.
You'll have like some intense pain, and you'll get a lot of swelling, and it becomes very tender. So that's something that if you feel like you possibly have one, you want to let us know right away so we can get that taken care of for you.
Okay.
There are certain things besides just the blood thinners on ways to avoid that. So bending at the waist, that can cause like a rush of blood to the head. So those vessels are fragile at this point, so we don't want, a rush of blood going through those at the, this early. And then also, don't lift anything heavy that first week as well. So I usually say nothing over like a half a gallon to a gallon of milk. Nothing more than that first week. So you don't want to overexert and get the blood pressure and heart rate up, because that can cause some bleeding as well.
Okay.
Okay?
All right.
And then of course there's no strenuous activity for 4 weeks. So this kind of talks about, like walking is allowed. We want you to get up and walk around a little bit, but nothing like overexerting, no power walking, no uphills, that type of thing. Because you do need the blood flow and the circulation to help heal though.
Okay.
Just nothing strenuous. And then we will make appointments for you to be seen the day after surgery, 1 week after, 1 month after, and 3 months after. Okay? And then on the bottom of every sheet, there is our office number and then Dr. Karam's cell phone and home number. So if anything comes up after hours, overnight, or over the weekend, you can call or text him anytime. So don't hesitate at all. Okay? So this is for the face, neck, and brow lift, okay? So when you leave, because you had these done, you do have to come back the next day, because we have to check and make sure that you don't have a hematoma.
Okay.
Because usually if you do have a hematoma or any bleeding, that's usually going to occur in the first 24 to 48 hours. After that, your risk goes down pretty drastically, but we still want you to be really careful that first week. Okay? So you will leave with a dressing around your face. It's kind of a compression dressing, but you will get that off the next day when you come in. And with that, you may see a little bit of drainage or blood coming through on the bandage. That is totally normal and totally fine. If it is saturating it, then that's too much. You need to let us know, okay? But if you see a little bit, that's normal, because you do have 3 drains in. They're called Penrose drains. You're gonna have one here, and then you'll have one on this side and one on this side. They're nothing that you have to do anything with. You probably won't even see them because they're going to be covered by the bandage. And when you come in that next day, we're going to slide them right out when we take that bandage off, and you won't even feel it because you're still going to be numb. So it'll be really easy. You won't even have to mess with it. But it's helping to get any extra drainage out, any extra numbing medication that he put in, so that lays nice and flat and heals nicely for you. Okay? All right. So starting that second day, just make sure that you do clean those incisions with the hydrogen peroxide and Q-tip. So you'll soak the Q-tip in hydrogen peroxide and kind of lay it on the incisions there, and it'll react with the blood there, and it'll help to dissolve that, and it'll help clean those and keep those nice and clean so that they heal nicely. Okay. And then you'll apply the Aquaphor that we talked about. So that's going to go on these incisions, on your facelift and brow lift incisions and your neck incision here. Okay. And so you'll do that twice a day, starting the second day. Okay. Just no washing the face because we are doing the laser too. So you'll just clean the incisions.
Oh, okay.
Okay. All right. So, like I said, problems are uncommon following the facelift, and if the bleeding happens, it's usually that first 24 to 48 hours. We've already talked about the hematoma and the no strenuous activity, and again, down here, the phone numbers are on there. With the fat transfer, you will have definite swelling. There's no way around it. He's in there manipulating that tissue, gets a little aggravated, and it's gonna swell, okay? Bruising is possible. Everyone's different. Some people bruise, some people don't. So that is something that's possible. The swelling and bruising usually improves in 1 to 2 weeks. By that second week, you'll really start to appreciate that fat transfer, okay? Because you're gonna be really significantly swollen at first, okay? This is probably the most important part with the fat transfer. You can ice 20 minutes on, 20 minutes off, but only for the first 48 hours. Okay. So when you leave here after surgery, that's when your 48 hours starts. Okay. And when you do 20 minutes on, 20 minutes off, you want to have a little barrier when you have the ice too. So you don't want that directly on the skin because you may still be numb, and the ice can burn the skin. So you want to make sure that you're protecting your skin from that. Okay, so that's probably the most important part. And you don't have to do it all the time. You don't need to wake up in the middle of the night and do it or anything like that. You may be resting during the day, that's fine. Just when you're awake and can do that, it'll really help with the swelling. Okay. And very, very important too is remember that the fat transfer is a very gradual process. So you will be very swollen in the beginning. That swelling will settle, and you'll probably really start to like it about the 2 weeks, 4 weeks, maybe even 6 weeks. Once you hit that 2-month mark, that's when the fat transfer is at its lowest. So if you think about it, you've taken these fat cells that are established somewhere else in your body and they're like flourishing. You've put them into a place that's kind of foreign to them. So they're waiting to get that blood supply and nutrients and get established there. And once they do, then they start to plump back up. So at 3 months, 5 months, 7 months, 9 months, even a year, you're going to see a gradual improvement. So don't get discouraged at that 2-month mark thinking that it didn't take. Okay. So like we already said, avoid bending over and lifting anything heavy. That's going to increase your swelling as well, okay? And then things that are very normal is significant swelling. It's also very normal to have one side of the face more swollen than the other. Okay, and that's just how the body heals. It doesn't mean that he put more in one side than the other, unless you needed it for some reason, but it's just how the body heals itself. It's also very normal to have hardness and bumps. That is very often related to the swelling. Once the swelling goes down, then those will soften and go away as well. Okay, and then we always say this, it's very important to understand you're not going to be looking like yourself at first, usually that first week, so don't get discouraged. Maybe try to steer clear of the mirrors, but it's definitely, you're going to be definitely swollen and not look like yourself. So with the eyes here, it is very common that first 24 hours to have kind of a burning sensation. Not necessarily the eyes, but where the incisions are. That's very normal. I've put some extra gauze in your bag for you, and you can soak that in some chilled water, lay it on the eyes, and that'll help soothe that for you. Or you can ice, same way, 20 minutes on, 20 minutes off. And with the barrier. Past that first 24 hours, then the itching kicks in because it's starting to heal. So, and what we give you is this Lubrifresh ointment. And like we said, the Aquaphor is going to go on these incisions here. The Lubrifresh ointment is actually going to go on these incisions for the eyes.
Oh, okay.
So for 3 reasons, basically. It's really good at healing the incisions. It's going to help with the itching because it's keeping it nice and lubed. And then when you come in to get your stitches taken out at that week mark, they're going to slide right out instead of being kind of crusted in there.
Oh, okay.
So it'll be a lot easier on you.
Okay.
Okay. And there's no really specific put it on every 2 hours or 4 hours or anything like that. Just when it looks like it's starting to dry up, just take a Q-tip and dab a little bit more on.
Okay.
And we will put some on when you leave after your procedure, and then when you come in the next day too, we'll put some on you at that point too.
Okay.
Okay. And then the other thing that this can cause is dry eyes. So we put in these little refresh drops for you too. So if you feel like just rinsing the eye out and flushing it, or if you do have a little bit of dry eye, you can use these as well. It's not a chronic thing, it's a very temporary thing.
Okay.
Okay? All right. So, as far as do you wear contacts at all?
No.
Okay, so you won't have to worry about that. It's just you can't wear them for 7 to 10 days, but glasses can be worn. That's totally fine. You're going to be very red. Your skin may be oozing a little bit. That's normal too. You may have some pinpoint bleeding. That's all very normal. You may have a little bit of swelling from it too. Mm-hmm. So it can be a little nerve-wracking at first. But if it heals in time, as we usually say about 10 to 14 days, give or take a little bit. It just depends on the person and how they heal. So things that you'll need to get, we've already gone over some of this that you'll already have for these other procedures, but Aquaphor, I recommend cotton rounds, because if you get cotton balls and you're trying to take the Aquaphor off, the cotton balls can kind of stick to the Aquaphor,
yeah. Okay.
so, and then you'll have all these little fuzzies from the cotton balls. So, and then distilled water and white vinegar, you're actually going to use this when you're cleaning the face, and I'll go over that a little bit more. And then Cetaphil lotion and Cetaphil cleanser. You can get these at like Walmart or something, and they're very neutral, very gentle on the skin for this process. First 24 hours, you're not really going to do anything but ice, and then make sure the Aquaphor stays on at all times. That's probably, besides the washing, and the most important thing is that you want the Aquaphor on at all times, because you do not want that to dry out. If it dries out, it can crack, it could scar, that type of thing. So Aquaphor is very, very important. You always want to keep that moisturized. Once you get past that first 24 hours, you're going to start washing the skin twice a day. Okay, so you're going to remove the Aquaphor ointment with a cotton round soaked in the distilled water. So you're going to remove that, then you're going to take another cotton round and you're going to use a vinegar water rinse and to clean the skin, okay? Mm-hmm. And then once you do that, then you're going to rinse the vinegar water rinse off with another cotton round with distilled water.
Oh,
okay?
Okay.
Yeah, so you're going to go distilled water, and then the vinegar water rinse, and then distilled water, and then you're going to pat dry, and then reapply the Aquaphor. Okay. Make sense? Mm-hmm, okay. Mm-hmm. Okay, so you're going to do that twice a day after that first 24 hours. Starting days 2 through 5, you're going to do the exact same thing that we talked about, but you're going to start doing it 4 times a day instead. Okay. Okay. If you have any peeling or flaking, do not pick at it. Let it do its thing. Let it fall off if it's going to, or if it's going to hang on for a little bit longer, let it hang on. Just because if you pick, you can change the pigmentation. So you can hyperpigment or hypopigment, or you can cause some scarring. So just lather on the Aquaphor, make sure it stays nice and moist. Points on day 3, you can shower. That's fine, and you can let the water hit the skin. Make sure it's a tepidly warm water, nothing too hot, nothing too cold, because that won't feel good on the skin. So starting days 5 through 10, you're going to clean with the Cetaphil cleanser instead of the vinegar water rinse, if your face can tolerate it. It may not tolerate it, which means maybe it gets a little red from it, has a little burning or maybe heat to it. And if it's uncomfortable for you, just go back to the vinegar water. That's completely fine. And then, maybe day 7 you try the Cetaphil if your skin wasn't reacting to it well at day 5.
Okay.
Okay. You're still going to wash 4 times a day, and you're still going to apply the starting days 10 through 30. The Cetaphil cleanser and the Cetaphil lotion, so no more Aquaphor, and you're going to go back to twice a day. Okay?
Oh, okay.
At this point, you can start using this as sunscreen. You want it something that's at least 7% zinc oxide, because that's what's going to protect you from the UVA and UVB rays.
Okay.
Okay? And then at this point, you can also start using a natural powder as well. So something that is a mineral makeup that still allows the skin to breathe. So very last thing here to go over are the supplements. So we provide a supplement kit here that has everything that you'll need. And our patients see a really good difference, or we see a good difference, I guess, between the patients that do take it and the patients that don't. It really aids in the recovery time. It's going to help with keeping the bruising to a minimum. If you do bruise, it's going to help keep the swelling to a minimum. If you swell, which you will with the fat transfer for sure. But it's going to help with all that, especially since you won't be able to ice after that first 48 hours. So we put everyone on an antibiotic.
Okay.
So the antibiotic you're going to start 1 day prior to your procedure.
Okay.
That's going to help get you started before the procedure even happens and gets your body ready for that. Okay. The other thing that's on here is your pain medication. It's a little bit stronger pain medication if you feel like you need it. However, this one does have Tylenol in it. So don't take the Tylenol with this. It's one or the other.
Oh,
but if you
okay.
start out on one and want to switch, that's completely fine. You just need to wait that 4 to 6 hours before switching. Okay? And then we always give it an anti-anxiety medication. You need to take that 1 hour before your arrival here. Okay, and then we always give an anti-nausea medication as well, just in case you need that. You definitely don't have to take it if you don't need it, but we always like to prescribe it just in case. And then we also give a prophylactic antiviral because of the laser that we're doing. So some people are prone to cold sores, some people are not. But even if you're not, we like you to be on it just in case, because we are resurfacing the skin. We're taking it to a deeper level, which can cause the skin to react that way. So that is something that you would actually need to start 2 days before.
2 days, okay.
Yeah, and the instructions are on here on on how to continue everything as well.
Okay.
Okay. Do you have any questions at this point?
I did have one question about a couple, about the coffee. I drink coffee. Is there any restrictions on caffeine?
Sure. So typically what we say is no caffeine the day before, the day of, and the day after. But if you're taking the arnica supplement, it can decrease the effects of the arnica. So while you're taking that arnica, you start 3 days prior, and then you continue for a week or 2 after. So I would want you to stay off of it, or we would recommend that you stay off of caffeine for that reason, so you do get the full benefits of the arnica.
Okay. And then my other question that I'd written down, something about the Spanx that you had mentioned. How tight do they need to be, or could I use an ACE bandage to keep compression, or what's
Yeah, you can definitely use an ACE bandage too. You do need some good compression there. We typically say you need to wear it for about a week. And what that's doing is it's aiding in that area to heal where we've harvested the fat. And then it's also helping to compress that so that maybe you won't get as much bruising as well. So you do need some compression. I mean, obviously nothing too tight because we don't want to cut off any circulation. We want some good blood flow. But something tight enough where you have a little bit of compression there.
Okay.
Okay,
I think that's all the questions I had. You've covered everything, so.
Okay, perfect. Well, your surgery's in 2 weeks, so we will see you back here then. But do not hesitate to call us or email us or, get a hold of us if you have any questions. We're here through the whole process for you and beyond. From here, basically what I would do is show you how to get to our OR in the morning, because it's a little different than what our office is, where you would normally come in for another appointment.
Oh, okay.
Okay, so I'll show you that, all right?
Sounds good. Thank you so much.
Of course,
so
it was nice to meet you. I look forward to seeing you in a couple weeks.
Likewise.